Hello everybody. Today I'm going to be discussing ultrasound therapy for chronic pain, which was the subject of a paper that Robin Thind and I, Tate Zavitz, worked on together as a part of our capstone course for our sonography program at BCIT. Within this paper, we discuss both chronic pain, existing treatments for chronic pain, why ultrasound therapy might be a promising treatment for chronic pain, and then we go on to discuss three different modalities for ultrasound therapy and what they are used to treat and whether or not there are some limitations to them. To start us off today, I want to talk about chronic pain and its prevalence in Canadian society. So, 1 in 5 Canadians actually struggles with chronic pain, and chronic pain can be caused either from a traumatic event, an injury, repeated stress to an area, such as what we do in sonography, or from chronic illness, such as Lyme or Crohn's. It also has prevalent tools both on an individual's personal life, their emotional and mental health, in addition to their physical health, and on them financially, as they may have to travel to seek treatment. Pharmaceuticals are often not insured by BCMSP, and many people don't have extended benefits, that sort of thing. Additionally, it also causes a financial toll on our healthcare system, as people with chronic pain have to routinely seek treatment for their pain in order to lead functioning lives. Chronic pain is currently treated largely by pharmaceuticals and physical therapy. However, there's drawbacks to both of these, especially with pharmaceuticals. It results in drug dependency if people are on pharmaceuticals long term, and this is something that lots of people wish to avoid. There's also an increased risk of opioid addiction in individuals with chronic pain, as they're often prescribed these drugs to manage their pain. There's also the fact that pharmaceuticals alone are often not effective enough at treating somebody's chronic pain. And lastly, with physical therapy, it has risks associated with it as well, especially relating to whether physical therapy is performed correctly. If performed incorrectly, it can actually worsen an injury. And so that is the major drawback with it, is that you need to be able to trust your physical therapist. So why ultrasound therapy? How does this fit in? There's a lot of benefits to ultrasound therapy, and to start us off, I want to talk about how it's non-invasive. There's no surgical incisions to be made with ultrasound therapy. It also can be localized to an area of pain. This is as opposed to pharmaceuticals, where they have an effect on the entire body, as opposed to just the area of pain. If this is a localized injury like a muscle strain or back pain that's in one space. Ultrasound is also generally considered safe, as we're aware as ultrasound technicians with the ALARA principle. Also, ultrasound therapy can be used in addition to the pre-existing modalities, including pharmaceuticals and physical care. And doing this may reduce the need for pharmaceuticals and therefore minimize the chances of addiction and also minimize the chances of something going wrong with physical therapy. When Robin and I started writing our paper, we soon realized that the sheer number of different ways that ultrasound can be applied to treat chronic pain was beyond the ability for us to cover within our word count, and so we limited it to three that kept popping up the most often in our research. These three techniques are sonophoresis, low frequency ultrasound, and high intensity focused ultrasound, and I'm going to discuss each of these individually. So sonophoresis is a process and a therapy that utilizes the fact that ultrasound exposure causes cavitation within soft tissues. And this increases the permeability of these tissues, allowing drugs to be administered more effectively, especially across barriers, like this applies to the skin. So transdermal applications of pharmaceuticals are more effective. And this also applies to other barriers like the blood-brain barrier, which has exciting implications, although not for chronic pain. Sonophoresis is often used to treat rheumatoid arthritis. There are transdermal patches of painkillers that are used to treat rheumatoid arthritis, and they become more effective with sonophoresis application. So the transdermal patch is applied to the patient's skin, and then the ultrasound wand is passed over it, and this increases the permeability of the skin. Sonophoresis is actually so effective that it has potential to allow for new applications of pharmaceuticals transdermally. So drugs that otherwise would not be able to be administered this way because they weren't absorbed readily enough now may be able to be absorbed through the use of sonophoresis. Our second modality is low frequency ultrasound, and this one is the most commonly used modality to treat chronic pain with ultrasound. You often see this in physical therapy clinics, massage therapy clinics, and chiropractic clinics, where it's used in addition to manipulation or exercises to help with chronic pain. Low frequency ultrasound can treat both muscle pain and joint pain, and that includes muscle pain and joint pain of pretty much every kind. We found lists of conditions that it's used to treat that were 20 and 30 items long. So, knee pain, ankle pain, muscle strains, back pain, all these kinds of things. Low frequency ultrasound works through temporary hyperemia, so it increases blood flow to the area that it's applied to, mostly through the thermal effect of ultrasound. As tissues heat up, it increases blood flow to them. The only downside with low frequency ultrasound is that the scope of its efficiency is debatable, and I'm going to look into that a little more here. So, with the studies supporting low frequency ultrasound, many of them are poorly conducted or poor quality. When you adjust the studies for the fact that many of them are highly biased, there's a huge financial incentive for physical therapy, chiropractic, and massage therapy practices to continue using low frequency ultrasound because it's popular with their clients and has a really good, a cool image as like this cutting edge technology that is magically solving their pain. Um, and also with companies who sell ultrasound machines. Additionally, a lot of these studies are unblinded, and so patients know whether or not they're receiving ultrasound therapy. And when accounting for that, there's not many studies that actually provide quality data. In the ones that actually do provide quality data and have large subject groups and their data is clean, ultrasound therapy is usually found to be fairly comparable to other treatment modalities, including physical therapy, massage, exercises, and pharmaceuticals. That doesn't discount low frequency ultrasound entirely, as it can absolutely be an option or used in conjunction, conjunction with these other things. However, it does bring up the fact that ultrasound machines are expensive, and if it's doing the same thing and is just as effective as something else that somebody can do with their hands that doesn't require specialized treatment, maybe the other option will be a better choice for a clinic or for a patient. Our last modality is high intensity focused ultrasound therapy, and this also works by using the thermal effects of ultrasound. However, it's much more intense than low frequency ultrasound. The beam in this is incredibly focused and incredibly intense to the point where the thermal effects are so extreme and tissue heats so rapidly that it causes coagulative necrosis and immediate cell death. This effect is used to ablate tumors mostly, and these tumors can result in chronic pain. Fibroids is a kind of tumor we see that frequently causes discomfort. They can treat both malignant and benign tumors, so we've also seen this used for prostate cancer. High density focused ultrasound also has a very interesting application for neuropathy pain and tremors, where it can be used to perform a thalatomy as opposed to a surgical excision of the thalamus. And this allows the, the patient to not have to undergo brain surgery in order to treat their tremors and their neuropathy pain. High frequency ultrasound is frequently conducted under MRI guidance because it needs to be so specific to the area that is being targeted. So, along with the limits I discussed with low frequency ultrasound and the studies done for it, there's other limitations for all ultrasound therapy across the board when we performed our lit review. The main one is that it's really difficult to assess the independent efficiency of ultrasound therapy, as almost every study we reviewed mixed ultrasound with a pre existing therapy, including massage or pharmaceutical or stretching exercises. So it's hard to say if ultrasound is actually effective on its own or if it's only used as a supportive tool for chronic pain treatment with other modalities. Additionally, there's also limited research to outline long-term benefits of ultrasound therapy, and that may be due to the fact it's very novel in treatment of chronic pain, and so we just haven't had the time for those studies to come out yet. However, we did review numerous articles from the late 90s and the early 2000s, and so it has been a while, so it'd be nice to see those. So before Robin and I can fully endorse ultrasound therapy as a cutting edge technological cure or treatment for chronic pain, we'd like to see those studies come out. Here are our references for you all. And here are the references for the images used in this presentation. These links are accessible on the PowerPoint file itself. Thank you for your time, and we'll now take some questions.